So what I'd like to do, I want to try to make this short because I know that the most valuable part of this whole seminar is your chance to work together in your small groups, because that's where you get to apply a lot of the things that we'll be talking about. A little bit of an overview of my hour 15 minutes is that I want to cover these topics. I want to go through some real basic fundamental principles about assessment, talk about the a 6-step process for actually developing an assessment, move to the issue of using assessment to actually foster learning, not just to check on whether learning has happened, but actually as a tool in the teaching process, because I think that's an often unrecognized and often underutilized characteristic of assessment that we can use. Give you some examples of how that might actually work, and then turn you loose to your breakout sections to actually work on your own courses, your own syllabus, to think about how you might go about assessing some of the objectives and the outcomes that you talked about yesterday. Some ground rules. Obviously, you're going to build on what you did yesterday, so there should be a continuity. You'll see some things that I'll mention briefly that you've already talked about yesterday. I want, and in another slide, I'm going to review the breakout session so you know what you'll be doing this morning, so when you listen to what I say, you can start fitting that into a context. And then I want you to ask questions. This is supposed to be interactive, and I want you to stop me. Don't let me build up a head of steam, and I'll just run right on through. But ask questions as we go through this of anything that's not clear, because there will be a test. So the instructions for the breakout. After we're done here, you're going to go back to your rooms, break up into your small groups of, I would hope, 4 to 5 or 6 people. And I want you in your group, as a group, to pick one learning outcome from one of your syllabi. One person wants to volunteer or focus on one outcome that you think is going to be interesting or a challenge, and to develop an assessment method to measure that. So how do you know that you've achieved that outcome or that objective? So how will you assess that? To develop and just brainstorm an assessment method for doing that, and then within your group discuss how you might, after you refine that assessment method, how you might actually use that to improve the teaching. Not just for figuring out whether you succeeded, but actually promote the teaching process. And I'm hoping that you'll have a chance to go through that cycle 2 or 3 times, so you can try it on different kinds of outcomes. So a couple of the background items. I'm from a medical school, so a lot of my examples are going to be medical in nature. And I've come to appreciate that medical education has some unique characteristics like each of your disciplines. One thing about medical education is that a lot of the assessment gets done in practice. So it's outside of a traditional classroom, which lends some opportunities for assessment, but also some constraints. So I'm hoping that my examples from that field might, they may not be immediately relevant to you in the humanities, for example, but as a way to get a sense of just how broad we can cast the net when it comes to assessment. So, why do we assess learners? There are lots of reasons. Sometimes we assess learners to figure out where they belong in a program, in a course of study. So where are we going to place them? My wife teaches 4th grade. She talks about using assessment a lot to place her students in reading groups or math levels. Who needs to have remediation? Who needs to be in a program for advanced education? We do a lot of assessment to select people. That's how you got into graduate school. You were assessed. We all will often do assessment to diagnose problems. So a student isn't doing well and we're trying to figure out what's the issue. Is it a learning disability? Is it motivational? Is it background preparation? We do a lot of assessment for advancement. When are people ready to go on to the next course, the next stage in their training? Grading, documentation. So we use assessment for a lot of things, but the key thing is that we're using it to make decisions. So assessment is for a purpose. It's not just to do it because we have to do it. We don't do a test simply because we have to do a test. We're trying to make a decision. And the decisions that we're trying to make require data. And that's what this is all about. How are we going to get the data for making decisions? All of these decisions that we've just talked about. The important thing to recognize as a theme throughout this is that the quality of the data is proportional to the importance of the decision. So that if you're making a high-stakes decision, you really have to have very good data, very solid, very reliable, very valid data. If you're making low-stakes decisions, and as an advance, this is using assessment to promote learning, that is an application of assessment that doesn't require as much rigor. So you can do a lot of creative things, a lot of innovative assessments for lower stakes decisions to figure out, what am I saying that's confusing to the class? That's an assessment that can be used for a smaller decision about how I need to revise this session for next time. So let me give you, so when we're talking about quality of assessment, we're talking about resources. The fact that every time we do an assessment, it takes time, it takes effort, it takes, when you're with your students will give you a limited pool of goodwill. And everything you do in assessment drains that pool. So you can decide to drain that pool very quickly or very slowly. So to think about your assessment as costing something in your relationship with your students, it may require some additional expertise and technology for lots of ways that assessments are resource intensive. And to make careful judgments about what's worth doing. We'll talk about that a bit more when we decide of all the objectives and the outcomes that you want to accomplish in your teachings, which ones really matter? Because those are the ones that you'll invest time assessing. You can't assess everything. So the logic of assessment is, it starts with your objectives, the things you worked on yesterday. To figure out exactly what you're trying to accomplish in your teaching, to state these in ways that are really observable. Because if you can't observe it, you can't measure it. The challenge in educational assessment, unlike measurement in a lot of other fields, especially for you in the STEM disciplines, is that what we're trying to measure is all stuff up here. And you can't measure it directly. So the logic of educational assessment is to get what's up here out into some observable form. And that observable form is always behavior. So you have to watch, you have to assess, observe your learners doing something that gives you evidence that lets you infer that your objectives, knowledge, understanding, better attitudes, skills, have been attained. And that's the challenge of trying to figure out how to get what's up in here out into the real world. So to do that, we need to come up with a task. So what are we asking the student to do that will tell us by their behavior, the results, that they are now able to do this task, which means they've learned what we're trying to accomplish. And we'll talk about this in a lot more detail in a bit. So develop that task and then capture the learner behaviors. So some way to record what they've done. So you get a record and then you need to quantify the quality of that performance. How well did they do? After you do that, you need to, to some degree, set a cut point, a decision. That point at which you're making a decision whether this is a pass or a fail, whether they should go on or be retained, whether we want to select them or not select them. What's your decision? Because this is the data that goes into that decision, and to make a judgment about what scores, what level of performance you need to have to make that decision. and then ultimately to evaluate how well that assessment is working. Is it reliable? Is it valid? Is it producing the results I want? All right, let's put this in an example. So this is an outcome from an anatomy course. In this case, it says that one of the outcomes, the learning objectives, is that we want the learner to be able to define the connection between clinical case studies, resistance training methodology, injury and disease treatment and prevention, and identify the anatomy and muscle action. So it's a very complex, multifaceted objective. So if this is our goal, if this is our learning objective, our learning goal, how are we going to assess this? Well, the first thing we do if we go back to our list of steps is we have to define a task that will show us that our learner can do this. And in this case, and I've taken this from one of my students in past years, she came up with this as a task. So it's a problem, a story problem, a paper-based case. And you can read that to recognize that this is a scenario of a situation that you might encounter in exercise physiology, where there's a football player has an injury after a tackle. So the challenge is to figure out what nerve has been injured. So if this is the task, this is how she decided to capture behavior. So if you think of this as the task, there might be a variety of ways you could respond. You could take this task if you had a lot of money. You could actually stage this and have a football player come into the room with the complaint and have the student actually perform an examination, try to figure out what muscle and nerve is involved. So lots of ways you can take this task. It doesn't have to automatically be this paper case with a multiple choice set of responses. But the key thing is to recognize that there's a problem, a task, something that the student has to do, and some way that you can capture that performance. And in this case, they're capturing the performance, the behavior is picking an option from this list. Now, you might not always think of a multiple choice question as being a task in this way, but that's essentially the logic that's going on here. So we've captured the behavior by their answers here. Now we quantify it. How good was that behavior? And in this, I don't know if this is the right answer, but we would say that one of these is the right answer, the rest are wrong answers. So that's our quantification. And ultimately, we would try to aggregate knowledge in similar questions over multiple kinds of items so that we have a score on this exam of the results of this, of our course, that we could then aggregate and define a cut point, a passing score that students would have to succeed in our course. And then ultimately, at the end of the course, take a look at our assessment and decide, did this work the way it was supposed to? Did it produce what we wanted to? So that's the logic. That's the fundamental problem, finding the right task, getting the behavior, and recording that behavior and scoring it. That's the logic. So what I want to do is to go through a 6-step process, and again, this is detailed in a lot more depth in the handout, a 6-step process for actually building an assessment that will put this logic into practice. And again, stop me anywhere in the process here to get questions clarified. Apply it to your own situation. So 6 steps. Define and categorize those educational outcomes that you talked about yesterday. Select the assessment method, the kind of procedure that you want to use. Define a relevant task. Quantify that behavior, set your standards, and then evaluate those results. So the first one, in defining and categorizing the educational outcomes, I understand that you did a fair bit of work on that yesterday. Recognizing Bloom's as one framework. I know you talked about Fink's. There are a variety of frameworks to think about different levels of educational outcomes. And again, I want to emphasize what you heard yesterday is that these outcomes need to be specific and observable behavioral language. Simply saying, as many of my colleagues like to put down, they need to understand pathophysiology or pharmacology or immunology. Understanding, that's what's happening in here. You don't know their understanding unless they do something. And that's the behavior of the task that we're trying to focus on. So think about those outcomes and objectives and observable behavioral standards. And again, this is expensive stuff. It takes resources, so focus on things that matter. I want to try to get you to think about outcomes in 4 categories. These are not the categories that you automatically will see in a lot of textbooks, because what I want to do is break Bloom's into these first 2 levels here, the knowledge that we were just talking about, and higher level cognitive skills, so the problem solving, the analysis, the evaluation. Not because they're different, although they are in some ways, but because they often have different assessment methods associated with them. Think about outcomes that relate to attitudes. So the challenge with the affective domain, if we can describe it that way, is to translate that into some observable behavior. Because these are values, these are very internal kinds of things. And they should manifest themselves in various ways, but it's not always going to be really obvious or really transparent. And then finally, the performance and psychomotor skills. This is, again, in medicine, this is a very important outcome. So you've got a lot of outcomes, a lot of goals in your teaching that you can think of. And I'd encourage you in your breakout session to think a little bit broader, not just the knowledge stuff, not just Bloom's, but think of these other kind of domains of outcomes. You talked about Bloom's, and again, I made that division there between the simply recalling factual knowledge and a lot of the application. It's worthwhile, and in your handout you've got a greater detail, a description of this, that there have been other frameworks and hierarchies developed for these other domains as well. So there's a framework for thinking about different levels of affective outcomes. Other frameworks for looking at the psychomotor domain. Not going to go into these in detail. It's in your handout if you want to pursue those. The key thing is to recognize that there are some traditional assessment methods that link to these various domains. So in this case, we would need to take these internal states and translate them into a behavior. And one framework that we've been using a lot in the health sciences is to think about the assessments in terms of this hierarchy, where a lot of our assessments in school tends to focus on the bottom there. We assess what people know. But when we go higher up into certainly Bloom's taxonomy, we're trying to look at how people start applying that information. So they just know factual information or know how to solve problems, the theoretical understanding. But then more rigorous is being able to show that I know how to use this information. Show this in our paper problem of the football player. Show it in a controlled environment, so a classroom setting where it may not be real life, but we can show we can solve these problems. And ultimately to do it in real life. And again, in medical environment, we do a lot of this, of observing students and residents actually interacting with patients. So we see that they can actually do it, not just show it in a controlled environment. But to recognize that this is a bit of a hierarchy, that each of these is more sophisticated, more complex, and more expensive to do. So the common assessment methods for these various domains, when it comes to knowledge, we've got a lot of technologies, a lot of tasks that we are very familiar with for assessing knowledge. The multiple choice, essay, tests, short answer, lots of different formats that are basically asking a question, getting an answer. When we come to higher level cognitive skills, we have other technologies like problem sets in engineering and math, projects, creative writing, critical analysis of a philosophical argument, oral presentations. Again, things that are primarily based on cognitive knowledge and problem-solving skills, but expressed in different ways, different tasks. For attitudes and values, we have done a lot with questionnaires and surveys, so we ask them, priorities and values will contrast two priorities. Which one do you lean towards? What's your preference? How do you answer these questions? And in performance and skills, we have various kinds of demonstrations in various real-world or controlled environments, more or less authentic. So you can diagnose and troubleshoot a faulty piece of equipment, do a performance in the humanities, other domains as well. So these kinds of tasks get linked to different kinds of outcomes. Excuse me. And the key is to recognize that depending on what kind of outcome you're interested in, you may have different technologies available to you. But the key is to be creative. Excuse me, don't feel tied to these technologies for doing your assessments. All right, so the big challenge, and this is where we'll probably spend the most of our time, is defining the task. Because this is where, as I mentioned, you can be innovative and creative. This is where a lot of the real work in doing a good assessment comes, is figuring out what the student needs to do to show you they've achieved this outcome. First thing I would suggest is when you look at your outcome, think about how this would be demonstrated in the real world. So if your student had this value, had achieved this, had actually internalized this value that you were emphasizing, how would you see that? How would you know that they had it in the real world? What would you look for? Because most of what we're doing, we want to have some real world impact, I hope, because otherwise it becomes a very academic exercise. So if it's going to make an impact in their lives after they leave school, how would you know? And so doing exactly that, thinking about, okay, this isn't going to show up until they're actually in a classroom. Okay, so if it has to be a classroom setting, can you replicate that in class, in a controlled environment that we have here? I know what it would look like in the real world. I know how difficult it would be to replicate that in the classroom. If it's really important, it may be worthwhile doing that. So if so, then start doing the creative work of thinking of how can I simulate in my constrained environment the kinds of context or situation or problem that would elicit this behavior. And so I would guess you're thinking about, you could think about a simulated classroom, with simulated students. We're getting very expensive, but this is the kind of a task that would have a good prospect of eliciting the behavior you are looking for. So that's the logic here, of trying to figure out what kind of task can we come up with to elicit this behavior. So what we're talking about often in framing a task is to go from something that's very authentic, that would happen in the real world, to something that's much less authentic, but cheaper, that we can actually do. So in this case, you can actually observe a student do this sophisticated history and physical task, something we really try to do or teach in medical school, actually do it with a real patient. That would be highly authentic. That would be kind of the ultimate. So if they can do it in real life, okay, we've got good evidence. But in reality, that's hard to observe. It's chaotic. There are lots of other factors going around. We can't schedule it, so we try to find more controlled tasks. So we might bring it to do a simulated patient. So like your simulated classroom. That would be more manageable in some ways, less realistic. We might actually do the role play. Have practice taking a history, doing a physical exam on your colleagues, on your classmates. Or you might go very low authenticity and give them a paper patient, ask them, what questions would you ask in this context? So it becomes less realistic but more manageable. So it's usually this trade-off between realism, authenticity, and expense. And somewhere you'll find a balance where you can do something that is relatively authentic at a price that you can afford in terms of resources. So we just talked about this trade-off. So that almost every assessment we do is a simplification. And it's necessary, but to be cognizant of what you're giving up when you simplify. So when you simplify, you throw something out as being irrelevant. Be careful that those irrelevant things really are irrelevant. So another aspect of this is whether the task is planned or natural. So when it's planned, it's controlled. And that may be great for convenience, for making it logical, but a lot of what we might be interested in producing is a learner who can adapt to the complexities and the uncertainties of reality. And if that is a key part of your outcome, you may need to keep that in mind in developing your assessment tasks. So that task, defining your task, is probably the most important thing of the whole assessment process. Figuring out what question you ask, what task they need to perform, what's the setting. Once you've done that, which is a lot of the work, you also need to think about how am I going to capture their behavior. And again, there are lots of technologies for doing that. One thing is, do you want to capture the result, the end result, the product? Or do you want to capture the process that they use to get there? And it may be a subtle distinction, but it's an important one in some settings. Again, in medical school, for many of our basic science exams, we're only assessing whether they can get the right answer, the product. We're not assessing how they get there. So they can get the right answer by looking on their neighbor's test, which is not the process we're hoping for, or by applying the knowledge they diligently acquired through hours and hours of study to their problem in a very cognitive, very thoughtful problem-solving process, which is what we're hoping is the case. But the product doesn't necessarily result from the right process. So if you want to assess the process, you have to capture their behavior in a different way. So it might be videotaping or recording the argument rather than the final answer. And that, again, it depends on what outcome and objective you're trying to assess. So once you have defined and captured the behavior, you need to quantify it. There are lots of methods for quantification. Even simple things like your informal judgment of, okay, that was good, this wasn't so good. Even if you're not putting number on it, is essentially quantification because you're making a distinction. You have some standard, implicit, perhaps vague, poorly defined criteria that you're using to judge whether this performance was acceptable or not. So think about that as our quantification. Not necessarily hard numbers, but a distinction, even in terms of order. So we can quantify to different levels of precision. We can count the number of correct answers, which is what we do on a multiple choice test all the time. We can compare the response to a model. So this is the ideal answer to an essay question. And I can look at your answer and compare it to the model and decide how well they match and quantify that. We have rubrics. I know you talked about a number of those yesterday, correct?
That's later today.
Oh, that's later today. So rubrics, we'll learn about later today, is a framework for trying to systematize, make more rigorous, more reproducible the process of quantifying very complex outcomes. And then there are checklists, which are kind of a simplified rubric. So let's take writing as a task. So one of we may have outcomes that can be best demonstrated by actually writing something. Maybe it's a decision making, an analysis of problem, of a political position. And so my performance assessment, you can assess my own performance here by your own rubric. But the question really needs to be stated clearly. And I can't emphasize this part enough. Clarity in the task is essential, because ambiguity is going to leave the learner open to responding in different ways, and these may not be the ways that you expect. So whatever you're doing, multiple choice questions, complex, sophisticated behaviors, clarity in the task is essential. So work on that. And then in this writing task, you may constrain the task in various ways. You know, tell them how much space they've got, how many words, how much time. It can be completely wide open. So those kinds of constraints too will help control or define their behavior. But the key thing is, as a response to a task, this is very complex behavior to try to quantify. So there are a variety of scoring methods that you can use, and again, you'll talk about this more this afternoon. So you may have a global, holistic score just ranging from my sense that this is a very poor performance to a very strong, excellent one based on your prior performance as a judge. Or you may have a much more refined analytic scoring. And I'll try to demonstrate that with this one. So this is a task that you might give in a course, a psychology course, for example. So we're studying metacognition, and I want to assess your understanding of the term metacognition. So to do that, I'm going to ask you to rephrase it, to paraphrase it in your own words. How would you take this definition of metacognition and explain it in your own words? What does it mean to you? So we would have that task, and then we would have the writing, which might be a paragraph in length, and we might evaluate against this rubric. So remember, we talked about it in terms of the dictionary's definition. So a very weak response would be someone who just repeated what the dictionary said. That's the minimal. And we would score that very low. As opposed to a response that contains everything in the dictionary definition, but it's well articulated of the definition and clearly stated and fleshes out for the individual the unique personal characteristics of that term. So, but a range of performance that you could spread out with some structure to guide how you assign these numbers. Another kind of task would be a presentation. Again, another very complex, very sophisticated performance that has multiple dimensions that might need a more sophisticated scoring rubric. So in this case, you might have a variety of dimensions that you want to judge a presentation on. Could be how accurate the information was, how articulate it was, how well the presentation flowed, a variety of very different dimensions. Some dimensions may be strong, some dimensions may be weak. But you could assess this performance on the basis of all of those. For each of those dimensions, you may have a scale of performance ranging from excellent all the way down to unacceptable. So again, more complex behavior, more complex performance requires more complex scoring or quantification. The part that often unsettles people is the idea that you have to set standards. And you have to set standards if you're going to make a decision. I mean, you could collect data, but if you're not going to do anything with the data, why bother? So the standards can be defined in a couple of ways. As I said before, they can be very informal. You know, this was adequate versus inadequate, but at some point you have to have a boundary. So where do you define as being adequate versus not adequate? So these standards can take different forms depending on the decision that we make. But to recognize that any decision, every decision you're making requires a cut point. So if you're having a 4-point grading scale, you'll need 3 cut points to separate those 4 categories. Pass-fail requires 1. So the more points, the more gradations in your judgments, the more cut points you're going to need. 2 types of standards. I'm not going to go into a lot of detail here just to make sure that you recognize that there are 2 types. The relative standard is one that depends on how well the group does as a whole. So it's not looking at an absolute score. We're simply saying that the top 10% are going to get honors or commendation or graduation with excellence. 10% of the class will get an A. That 10%, the score for that may drift all the way down to 50% on the final exam. But the top 10%, no matter what their scores are, will get the A. So that's just grading on the curve. Something some of you may like, some may not like, but it is a way of setting standards. And these standards are designed to get a specific number of people in a specific category. What's probably more common is to have the absolute standards, where we want to define a score, a quantification on our assessment that people have to reach in order to achieve, for us to make a decision. So do they pass or do they fail? And these standards are typically set at a specific score. 80% as the pass-fail mark. And these are most often used for assessments in which you're trying to identify competence or make certification judgments. Quality of the results, to spend a little time on this, but this is where you would look at the reliability and the validity of your assessment. The reliability focuses on how reproducible is this assessment. If I did it again with at a different time, would I get the same results? If I did it with a different setting, would it be the same? Would it be the same with different observers? So again, the rubric is designed to try to promote the reliability of your results, of your scores. Validity is really about the trustworthiness. Are these results really getting at what I'm trying to measure? We use a lot of assessment scores for things like GRE, SAT, entry exams, lots of things that we know are really reliable, really reproducible, but they're not valid for the decisions that we're making because they're not measuring what really matters. So think about this. And I teach whole courses, semester-long courses on this stuff, so you're just getting an introduction to the fact that it exists. You're not going to be tested on this. All right, here is the test. So why do we assess learners? So I gave you this list of purposes, of reasons to assess before, but now I want to move into the next one, which is to think about assessment as a way to promote learning. Because if you think about assessment as a task that requires the learner to use all the things that they've been acquiring in the course to meet the objectives and goals that you've set, if they do that, they're also learning in the process. So they may be demonstrating learning they've already done, or they may be acquiring learning in the assessment process. So we're not going to take time for this, just in the interest of the time. But this is an argument that we wrestle with in the medical school a lot. And it is the idea that teaching to the test is not a good thing to do. And it largely stems from the fact that our testing is so bad. Our testing is largely multiple choice tests of facts. And acquiring these facts is, yeah, it's good, it's necessary, but it's not really what we care about. So if you teach only to get high scores or study to get high scores on those kinds of assessments, you're missing a huge part of the outcomes that we're really concerned with. My argument to my colleagues is that if you have a good test, one that's really tapping into the things that matter in a valid way to give you good data, teaching to that test should be fine. because you're accomplishing the same things. So there are real benefits, educational benefits to testing. Key thing is it gives feedback to the learners, and we've talked about that a little bit already in some of the discussion, that if the assessments are useful, relevant, and authentic, it's very useful for the learners to know how they're doing. This is maybe their only feedback that they're acquiring the skills that you're trying to get. It involves them in their own learning. You can use these assessments to guide the students with information that will enable them to focus on areas of weakness. You can also use it yourself in your own teaching to find out if something really goes bad. Okay, was this a problem with the assessment? Have I not been teaching this in the right way? You know, so this is good feedback for us as instructors as well. You mentioned self-efficacy, and a lot of our self-efficacy is built on this kind of feedback of our performance. So it can be very useful for modifying the student's self-image, sometimes raising it, sometimes appropriately lowering it. You have a lot of students who may be overconfident inappropriately of their excellent skills and ability that need to be brought back to reality. So again, a kind of feedback function. And if you use it appropriately, students can use the assessment as a way to judge their own progress. So there's a lot of ways that assessment can be actually educational in and of itself. But these are some examples, and I'll simply display them for you to give you an idea of how you can use different levels of complexity of assessment but still use them for benefit of teaching. Using our metacognition paraphrase task as an assessment, but you could do this as a teaching tool as well, simply by giving students back feedback on their writing, having them share as a group, small group. What did you say about metacognition? They learn from each other, they learn to judge the caliber of their own performance, their own description by comparing it with their peers. And in the process of this assessment as a task, it also becomes an educational activity. But basically it's the idea that you can take any professional activity, and whatever your discipline is, whatever your domain is, how people are actually going to work in the future, putting their degree into practice, use these professional activities as a way to both assess their performance but also to teach them. So you actually teach them to do the problem solving, the scholarly research, the writing, teach them to do it and assess it at the same time. So I just want to, to end by saying that the real value that I'm discovering more and more as I apply these in my own practice is that assessment is important for making decisions, but it's also incredibly valuable as an educational tool. Partly because it builds on this rather unhealthy fixation students have with testing as kind of a summative outcome, which is one use of it, but it has enormous value as an educational tool. And if we can try to split that fixation on the scores, separate that from assessment, I think we have access to a much more valuable educational tool than we've been typically making use of. So I'll stop there and I'm going to turn it over to Diane.
Yes. Thank you.
And you can do some more.